Okay. Well, we've got people rolling in. I would love to hear where you're calling in from if you want to drop that in the chat for us. I think we've got people from all over the US calling in, and they'll be rolling in for the next couple of minutes. My name is Sarah Weaver, and I am so excited about this conversation that we're going to have with Dr. Oyer and Delaney Baumann. We're going to be talking about ketamine-assisted therapy and alternatives for mental health. Denise is calling in from Atlanta. We love that. Welcome, Denise. So just to introduce myself, my name is Sarah Weaver. I'm a functional medicine nurse practitioner and the owner of Entourage Health, and I specialize in women's health and hormones, gut health, and I work a lot with people that have fatigue and mental health issues. I have a concierge functional medicine virtual clinic, and so that's really great for people that are busy. And I live between Indiana and Washington State, so I have a little bit of a nomadic lifestyle. And so, Laura, why don't you introduce yourself?
Yeah, I'm Dr. Laura Oyer. I'm a psychologist in Fort Wayne, Indiana, and I specialize in eating disorders, trauma, and ketamine-assisted psychotherapy. And so I really value the functional medicine lens of looking at root causes and really trying to help folks heal not just behaviors, but really that deeper work that many folks desire and really find helpful. So I'm excited to be here this evening, and Sarah, thanks for having me.
Yeah.
I'm Delaney Baumann. I am a dual certified family and psychiatric mental health nurse practitioner, and I am predominantly focused on perinatal women's health. So I see pregnant and postpartum women that are struggling with perinatal mental health disorders, and also work with patients experiencing eating disorders, and also work with Dr. Oyer doing ketamine-assisted psychotherapy.
Perfect. So, Dr. Oyer, I know you have worked with trauma and eating disorders for over 15 years. How has your view of mental health evolved since integrating ketamine-assisted psychotherapy?
You know, when I first was trained to do therapy, a lot of the models were very thought-based models. So think differently, you'll act differently, you'll feel differently. And while there's merit there, I think I just found that a lot of clients that wasn't enough. Like just changing our thinking alone didn't quite, really help all folks that I was working with. And so I was more in looking at like interpersonal and attachment, and looking at just some of the different trauma therapies like EMDR, cognitive processing therapy. And to me, those seemed like they had more three-dimensional depth when kind of helping folks continue to work on healing. But I think I still, just me and some clients just really still felt stuck. And so over the many years of trying to figure out, what can I do to build my toolbox even more to help clients, I really started looking at how do we help folks kind of go underneath those core beliefs that they have? How can we help them really start to shift how they see themselves, others in the world? And so in an effort to help others heal, it really led me down this path of psychedelic-assisted psychotherapy. I always joke that's not a place I thought I'd find myself ever, for multiple reasons. But here we are, and I've been just really interested and impressed by a lot of the research and the data that are really showing it is helpful to people. And so I did bring a little model I'd love to just talk through for folks, just because I think this is it's pretty new, and like, how does it work? Why does it work? And so this model I personally created. It's not been researched, it's not validated, so I want to name that. But this is just like a picture that I created to just myself understand maybe the how and the why it works. So I'm going to share it here with everybody. Hopefully you all can see it as we talk through it. All right, give me 1 second as I'm pulling it up. All right.
There we go.
Everybody can see that?
Yeah. Mm-hmm.
Okay, great. So this model kind of highlights that how psychedelic therapy can work. It can work in a multiple different ways. And so I'm actually, Delaney, I'm going to put you on the spot here just to talk a little bit about maybe that medicine and chemical reaction part of the model, just because I feel like that is in your scope of practice, and maybe you can speak a bit more to that, and then I can talk about the others.
Yeah, absolutely. So like many medications that we use in psychiatry, many of them, the mechanism of action is, we don't know the full scope of exactly what is going on in the brain, but we do have some information about how ketamine is functioning within the brain and the receptors that it works on, and why it may be beneficial for those that are experiencing anxiety or depression. So ketamine was initially created as and utilized as an anesthetic, and it is at lower doses. We utilize it as a dissociative psychedelic medication. So at sub-anesthetic doses, it really just works to kind of, it just takes certain parts of the brain offline. So it takes vision offline, hearing offline, kind of body awareness, and the ego can kind of be taken offline. And we'll also talk in a little bit about this idea of default mode network that it also has impacts on as well. From a chemical standpoint, ketamine blocks NMDA receptors, which is a type of glutamate, which glutamate is a neurotransmitter in the brain. And we have lots of different types of neurotransmitters in the brain: serotonin, GABA, norepinephrine, dopamine. And so glutamate is an excitatory neurotransmitter. So essentially kind of what that means is it lowers that threshold and makes neurons more likely to fire. Whereas GABA, for instance, is more of a calming or an inhibitory neurotransmitter, and kind of just like calms the nervous system down. So we know that ketamine does block that NMDA receptor, and because of that blocking further kind of downstream, that glutamate surge stimulates an AMPA receptor, which is also an additional glutamate receptor, and the activation of these seems to be the reason that we see kind of a rapid antidepressant effect. So patients, will sometimes report within 24 hours of utilizing ketamine and improvement in their overall mood. So the downstream effect of that AMPA receptor and also increases something called BDNF, and that is brain-derived neurotrophic factor. And that is essential for synaptic growth and regeneration. And so we know that low BDNF has been associated with depression. So that boost in BDNF directly helps kind of to reset dysfunctional neurocircuits that are kind of going on within the brain. We also know that neuronal atrophy, as well as volume loss in the brain, is found in patients that are suffering from depression. And studies have shown us, potentially that some of that neuronal atrophy as well as that volume loss can be restored when ketamine is utilized. Indirectly, we do potentially we have seen in some studies that there may be kind of a downstream indirect effect on ketamine levels as well, on dopamine levels. So that also may play a role. As we know, dopamine is a neurotransmitter that we have, is also an excitatory neurotransmitter, and has been shown to be lower in patients that are suffering with depression. We know ketamine has impacts on pain levels and works on opioid receptors, and also has some anti-inflammatory properties as well. And I want to circle back to what I referenced initially regarding the default mode network. And so when we think about our brain's activity when we're not actively engaged in doing something, doing math homework with your kid, or hopefully driving or paying attention to an office task. It's kind of like that background chatter, the daydreaming or the future planning that we think about. But sometimes for those that are suffering with depression or anxiety, those thoughts can be negative or can be repetitive and ruminatory in nature. And that kind of negative thought loop that is persistent can be really distressing, especially when that is kind of like the constant chatter that somebody that is experiencing anxiety or depression is, having throughout their day. So ketamine acts to kind of turn off that default mode network. And we've heard stories in our training of clients who utilized ketamine in a safe space, and they say that is the first time that they've really felt like their brain was quiet. So you can think about somebody that's experiencing OCD and having ruminations and repetitive thoughts and compulsive behavior. To have alleviation of that is so significant to them. So all of this kind of chemical changes and the opportunity that presents itself with some of these increase in potential growth and circulation, regeneration of the dysfunctional neuronal networks just bears a lot for this idea of neuroplasticity and kind of the opportunity that we have for new behaviors and learned behavior after utilizing ketamine. So yeah, if you want to chat about that kind of window of change, Dr. Oyer.
Yeah, so as Delaney said, right, the medicine ketamine itself does do some pretty great things in the brain that can be really helpful for mental health. We probably should have named this earlier, but ketamine itself is not FDA approved for mental health concerns at this time. But there is a lot of research that's being used off-label, so still legally just off-label, because there are a lot of research that still supports its use and its benefit. So if you were to just do the medicine under a safe setting, when it's prescribed to you, there can be some really potentially helpful things. But then there's also the synergy that we get when we try to combine it with that therapy. So I just want to quickly go through those other bubbles. So another thing that can happen because of all those chemical reactions is increased neuroplasticity. And so I think about, right, if the brain is kind of like a piece of metal, if you try to bend it, it's pretty tough, and you have to work at it a long time to get it bent and put a lot of pressure on it. But if you heat it up, it can bend a lot easier with not as much force. And to me, that's kind of how I think about what ketamine does. And then some other psychedelic medicines can do this as well, where it puts the brain in a state that learning becomes easier, and it kind of takes a little bit faster. And so another way of thinking about this, Gould Dolan, her and her team have done a lot of research around this theory of critical learning periods. And so if you think about when we're young kids, our brains are very open. We can learn things really easy to learn languages, learn a lot about ourselves and others as children. But as we get older, those kind of close, and it's harder to learn new things and to sort of change that foundation that maybe that was formed when we were little. So what it seems like with some of the early research they've done with mice, and I know there's limitations with animal studies, but it seems like ketamine seems to open these critical learning windows in about 48 hours for mice. Psilocybin and MDMA, two other psychedelics, seem to be about 2 weeks, and LSD was about 3 weeks. And so what that means then is it's like there's this opening of this opportunity to learn something new that previously has been maybe hard to kind of do in traditional talk therapy, where now we've got this great opportunity to do some really important therapy work. Another thing too is just relaxation in mind and body. As Delaney mentioned, we've had people that have said, I've never felt calm in my body, and so this is the first time I actually have just felt relaxed, and how helpful that can be, especially when you're starting, and we'll talk more about this later, but if you are getting some images or thoughts that come that might be distressing, to be able to reprocess those with a calm state, it can be so helpful. And then there's also this corrective inter or intrapersonal experience. So interpersonal, right, is kind of me and someone else. And so many clients, as I mentioned earlier, have a lot of attachment concerns. And so just that feeling of safe with another human is pretty tough. And so to be able to be in a vulnerable state with caring, attuned, supportive providers is really, really helpful for some people. And even if they're going through something hard, and, you know, we talk about touch and making sure touch is consensual and it's safe and there's boundaries, you know, but usually it's about a handhold about what happens. But if someone just needs to put their hand out while they're, you know, going through a journey, and having someone right there just to say, like, I'm here with you, you got this, that can just be so powerful and healing for somebody, especially in that state when their brain is so open. And then intrapersonal, that's kind of doing the work of internally with oneself, right? And so we think a lot about doing parts work, the parts of me maybe that have been wounded or are defensive, or the parts of me that I kind of need to keep working through to heal. We can do some really good work with the medicines in these ways. And then the last one where people can also experience healing is in the spiritual and transpersonal space. I think a lot of the folks I work with have a lot of spiritual trauma. And so there's a lot of maybe fear, anxiety, avoidance of anything related to spirituality because it has been so hurtful to them. And so I think that's another place where it's very interesting, even if that's not something someone wants to work on. It seems like that's a very common theme that comes up in journeys for people, is maybe experiencing the divine or God, or just this overwhelming sense of like love and care and being cared for and reassured by something bigger than them. So that seems to come up, and again, can be really helpful for somebody. So that was a very long-winded answer, Sarah, but I just wanted to touch on just some of those different components, because I feel like there's not one way or one reason I think psychedelics work. I think it's a multi-layered way. And for some person, you know, one person, it might be more of the medicine and the chemicals happening in the brain. Another, it might be kind of the spiritual and transpersonal experience that's the most powerful. And it could be the combination of any of these. So yeah, I hope that helped answer the question.
Yeah, absolutely. Absolutely. And I would just encourage, if anyone has questions that are kind of mulling around in your head as you're hearing us talk, please pop them in the chat and we will circle back and make sure that we answer them.
Yeah, I was curious about, for you, Delaney, just really like thinking about your experience so far doing KAP work. KAP is an acronym for Ketamine-Assisted Psychotherapy. Just thinking through that medical clearance, and for you, maybe like what safety measures do you think are important?
Yeah, absolutely. So there are certainly, from a medical clearance standpoint, some things that we're on the lookout for. So during the actual ketamine journey, there is potential increase in blood pressure. So hypertension, uncontrolled blood pressure is one thing that we definitely need to screen for, as we don't, you know, we know that there's going to be a transient increase in blood pressure during that time. So we want to make sure that baseline blood pressure is normal. Seizure disorders also are, you know, depending on history, may be a contraindication to safely being able to receive ketamine. And then sleep apnea, central sleep apnea, those things where airway obstruction may be a problem during the actual journey, is also something that we kind of think about and want to make sure of. I think that there is certainly a cross between what I do as with my family nurse practitioner lens, as well as what I see as a psych nurse practitioner. And so some of the other things, and Laura, you can talk about this too, who is a good fit for KAP work. But from a psychiatric standpoint, there are a couple of things that we also are looking for to make sure aren't contraindications. So past episodes of psychosis, current mania symptoms. Those with a bipolar diagnosis need to be screened and well educated with regards to pursuing ketamine. Active suicidal ideation is certainly another one that would require good screening and good safety planning if you were to pursue that. And substance abuse, active substance abuse is also another one that can kind of be a contraindication for going forth with ketamine. Yeah. Laura, do you want to talk about from a psychiatric standpoint, kind of what that assessment process looks like, and who is a good fit, who is an ideal candidate that would be a good fit for KAP?
I feel like in terms of who's a good candidate, I think someone who has done some kind of therapy or inner work already, I think going internal into the psyche and just jumping in and having no awareness of what's in there, I think can be overwhelming to someone. And so I think having some sense of, if I go internally, like what might be there, who might I meet inside, of myself. So some therapy, I think, has been helpful. Like if you've done some therapy, I think that's great. I think having some kind of coping tools, because at times, even though generally, if challenging material comes up generally, if you're in a calmer state to work with it, but not always. It can open things up. It can open up some traumas at times. And so I think being able to have some really good coping skills outside of a KAP session, to be able to, do grounding, to be able to do regulating activities, having support is really important. And I think because people are open, making sure that they're not going back to crisis, making sure they're not going back to, maybe relationships or spaces that are going to cause more harm. Because again, if you're already pretty open, it's not like we want to add more trauma to you, as if we can prevent that. So when people are going through this treatment, I think being very thoughtful of, in the day or days that follow, just trying their best to, calm, doing a lot more of therapeutic work. Some people go back and do some important therapy work, like EMDR can be very effective in those day or two after. So yeah, I think that people who are very comfortable with that and are kind of ready to go just a little bit deeper. I think there are certain psychiatric, disorders, maybe like depression, anxiety, OCD, potentially eating disorders, that I think work pretty well with this, PTSD. So some of those different diagnoses might also might be helpful for them if they, were cleared and appropriate. So yeah, I guess I'm curious too, Sarah, just from your perspective, what do you think about with functional medicine and psychedelic work? What do you think about, like, in terms of just who might be a good candidate, or the prep work that you do with somebody? Oh, I think you're muted, Sarah.
There we go. It's helpful when I turn my mic on. Like you, Delaney, or like you, Laura, I feel like I like to see people who have done some of the prep work ahead of time. So like looking at therapy, they might be looking at, have gone through a couple different medications and not felt like they had the response that they needed. And then from my own practice, I'm looking from more of like a group root cause perspective. So I'm working on correcting things like gut health, which is huge. It's 90% of your serotonin, a neurotransmitter that helps regulate your mood. And so if you have things like leaky gut or sensitivities to food or chronic inflammation, that can directly affect your emotional stability. And we know in functional medicine that mental health isn't just about trauma and neurotransmitters, but it's actually about your body too. So I like to see people who have taken a deeper look at things like gut health and even hormone balance. We can see some depression that can happen with people that are low thyroid or I think a lot of perimenopausal or menopausal women get improperly diagnosed with anxiety and depression when it's really a hormonal issue that is going on. That kind of sudden raise of feeling anxiousness, exhausted, insomnia, fogginess, or even being emotionally reactive when you start to get into your upper 30s, 40s. Um, they are actual messages around hormonal imbalance. And also just kind of looking from a nutritional standpoint. I think ketamine can be really helpful in the context of like when you're thinking about those diet and lifestyle habits that from day to day can impact how your blood sugars are stabilized, how well you're resting, if you're getting sleep, if you have a movement practice that is helpful. So I kind of look at this as like the next level. We've covered all the basics, still not quite there yet. Ketamine is a great option for that, or any psychedelic really. So Delaney, how do you balance your role as both, I know you talked about this a little bit, but how do you balance your role as a psychiatric and a family nurse practitioner when you're evaluating someone for ketamine-assisted therapy? I'm sure there's part of you that wants to jump in and fix all of the things.
Yeah, absolutely. I think, of course, my education and experience working in primary care kind of is definitely a part and integrated into my day-to-day work as a psych NP. But also this opportunity does allow me to put that family medicine hat on a little bit closer to my head, I suppose. And, being able to just make sure from a medical standpoint and a psychiatric standpoint that this is a safe and a good option. And, Laura and I both will independently meet with the client individually prior to going forth with KAP. So, both of us have the opportunity to do our own independent evaluations and, make sure that we are both in agreement that this is the right option for them from, certainly from a psychiatric standpoint. And then I kind of take care of that from the medical standpoint.
I know you guys are both in Indiana, and we do have some people that are going to listen that are not necessarily based in Indiana. What things that people should look for? And this is a question for both of you. What are some things that people should look for when they're considering going into doing a psychedelic experience as far as a practitioner to lead them?
Good question. Laura, you want to take that?
Sure, yeah. Yeah, I think it's, one of the things I think is asking that provider, like, what training have you done, or what mentorship, not that training always has to be in a formal setting, with certain CEUs or people, although that's very helpful. But just asking the provider, what's been their experience, what's been their training. I think that that's really important, because I do think there are, a handful. I want to say it's a little bit, I don't know, in right now to maybe be doing this in some places of the country. And so I do think, Delaney and I in our trainings have heard many stories about people who just sort of set up shop and started doing it and had very little training and or ongoing supervision, which we have. And so I think it's really important that, that provider that they're going to put their trust into is someone who is trained. I think, asking about maybe testimonials or have their client, what have people they've treated said before, I think that's really helpful. But I do think being able to talk about that, because you're going in a very vulnerable state. And I think what we know with psychedelics is your state of mind going into it really does matter, can really impact your experience with it. And so I think just, creating safety, maybe having multiple times with that provider if that's needed, I think could be helpful too. Those are a couple of thoughts, Delaney. I don't know if you have anything to add.
Yeah, I think just kind of going back to the diagram that you had at the beginning, Laura, and ensuring that you have a provider that is considering all of these different avenues. This isn't just about access to ketamine and receiving the ketamine. It is about the work that and the opportunity and the opportunity for learning and that opening that window, all of those different avenues, and considering all of those different puzzle pieces as a part of the treatment. It's not just purely about you coming in and getting ketamine and then going home.
Absolutely. So we do have a question from the audience about walking through, what does a treatment schedule look like? How long does a session take? How many sessions does one need to have an effective experience?
I can take that one. I think that's a great question, Denise, and one that I was hoping we would get to. So thank you for just teeing me up so perfectly. Yeah, so I think, every place does ketamine work a little differently. I think it's a little bit still uncertain. We're still trying to figure out what is the perfect protocol. Nothing's perfect, right? But what is the most helpful protocol for people? And so when Delaney and I created ours, we read a lot of things, we talked to a lot of people, and we really tried to put something together that we felt like was researched and that people who are doing this work day in, day out also said, yeah, we think that's great. So I want to name that, but our protocol, we do actually small groups. So it's 4-person. One, it's just a bit more cost effective. And I also think I just love group work, and I think walking with people alongside doing it. I know for me, when I did my own KAP experience, having others doing it beside me actually was even more profound than just me on my own. So personally, I think I really like the group work model. But what it looks like, so we do some preparation sessions, and those, we've done it where it's been like 2 sessions, sometimes 3, but we want to make sure that there's plenty of time for individuals to know what they're going to walk into. So we talk a lot about just what would you expect in the medicine session. We talk about safety. We talk about how someone could feel safe. We talk about intention setting. So that's something we haven't mentioned here, but intention setting, as I mentioned earlier, your state of mind going in can really impact the journey. And so intentions can be, I want to learn to feel safe in my body again. I want to improve my relationship with my body and my body image and fully accept it. I want to encounter my younger parts of myself that went through traumas and help them heal, right? So intentions can look lots of different ways, but really talking about what would be a good intention for my first journey. So we do that in the prep sessions. And then the actual medicine session itself, so we do a couple of those. And then the first medicine session, the client will bring in their own prescribed ketamine. And so it's oral ketamine. You can get ketamine in multiple different ways, but here at our clinic, it is just oral ketamine. And so usually the medicine sessions are about 3 hours. And so about the first half an hour, we're spending doing some kind of mindfulness. We help clients, we call them nest building. So they build their little nest with, blankets and pillows, and you're kind of reclined. People look like we're going to slumber parties. They're walking in with their pillows and blankets. But just kind of build their little nest to feel kind of comfortable and safe. And then Delaney does all the vitals and takes those, makes sure everyone looks like they're in a good place medically to take the medicine. And then people take the medicine, and this is probably the most unpleasant part generally of it, is they have to swish the medicine. It's like a lozenge, like a hard candy, and it breaks down, and you have to swish it in your mouth like a mouthwash for like 15 to 20 minutes. Doesn't usually taste super great, but we try to do some mindfulness to walk them through that. And then usually once the medicine is kind of taken effect and they've spit out the medicine, most folks choose to put on some headphones. So they're listening to music that we've kind of curated to just help kind of be background for the journey that they're having. And then they put eye shades on because light can be sensitive, and also it sometimes can actually help create some visualizations that they might have with eye shades. And then they're just laying there pretty still and quiet for about an hour to an hour and 30 minutes, somewhere in there. And usually what's happening for people, it can be an array of different experiences. Sometimes it's just quiet and calm. Sometimes they're actually getting images and getting visualizations inside of all different kinds of things. It can be very metaphorical or symbolic. It could also be just getting like thoughts coming in, and generally those thoughts, generally they seem to be very helpful. And so it's kind of like, if you think about like a dream, sometimes that's what people kind of experience, like almost like a dream-like state where you're kind of having these, but you have a little bit more control of your mind maybe than a dream. And that, like I said, they do that. Delaney and I are right there next to them if anyone needs anything. And then we also are able to write down if they want to say something like, write down the dragonfly or write down the tree. And we can take notes just to kind of help them remember what came up during the session. And then, as clients are kind of coming out, the medicine's wearing off, we provide them, once they come out, like some food and some drinks that they can have. And then we just give some time just to journal, like as much as they can remember what came up. We just have them write it down. We also have some art supplies because sometimes it's visual, so they want to put what they saw, visually on paper. And then we usually just spend a little time at the end just starting to share what came up for folks, and very slowly starting to kind of maybe piece together a bit of the symbolism and metaphor that may have came up. But we just sort of like don't do that too much of that quite yet. We just really want to talk about what came up. And then Delaney takes vitals again. And then we really encourage them to have like a calm, like I said, afternoon. They're very open. They can't drive home, so they do need a transportation provided, by themselves. So someone will have to come pick them up. So that session's about 3 hours. And then that's usually followed a couple days later by what we call an integration session. That's anywhere for like an hour, hour and a half, where we really do start to kind of go, okay, what is the meaning I can take from this? What are those anchors that came to me? What are the insights that I had that can help me make some important, maybe mental or behavioral changes in my life? And so we really start to kind of identify those and really start to unpack those and see how we can make those more, just like the ketamine being just a catalyst to kind of get some things shifted in their life in positive ways. And so we do 4 medicine sessions and then 5 integration sessions. So it's kind of that cycle of medicine, integration, and then we usually do a final integration as well. And the research seems to show about 4 to 6 treatments seems to be effective for people. Some people need a lot more, some people don't need that, but at least for the ones that we've done so far, 4 has felt like it was a good amount. And I think our group members have mostly said that has felt like enough, not too much and not too little. So hopefully, that answers that question. And I guess just maybe on that note of integration, Sarah, I'm very curious because you and I've talked a little bit about it, but you also lead these integration circles to keep helping with integration. I'd love to hear more about what you offer with that.
So absolutely. I think integration is such an important part of the psychedelic experience, and I'm so glad to hear that you're building it into your experience, because I think it makes meaning, and the other part of it is it normalizes the experience. And what I have found is, like, when people are doing psychedelics in the wild, so we'll call it, they are often feel very changed by the experience, and kind of that experience in itself can feel a little isolating. So I think that integration is an important part of aftercare, and psychedelics can open up all kinds of powerful emotional insights. And this really helps us make meaning of it and also put it into context. So not every psychedelic experience is fun, right? Like, there are some that are excruciatingly painful. And so having that community that can circle around and support and validate that experience is really important. We're doing integration circles in Fort Wayne at Pillar Yoga on a monthly basis, and we're actually going to trial this Saturday. It'll be our first time. We're offering it a online experience as well, so anybody can join us. And really, what that is a time to gather together, reflect, process, and ground their experiences in a safe place. And it's also a place for people that are curious about psychedelic experiences but haven't tried but have lots of questions. And so these are, we ask that people come, they're sober, we're not passing out psychedelics during this. We are doing some guided breath work or meditation to help settle down that nervous system and then create an experience. Often explore different themes of what's coming up for them with no judgment or pressure or feeling like they have to fix it. And it's really just about being witnessed and feeling safe in a community. So it's what we've learned through integration is insight alone really isn't enough. We can have these really powerful truths that pop up in a psychedelic experience. It's what we do with that awareness, how we change our habits, how we relate to ourselves and others, how we embody the healing that creates the real transformation. And so what the circle does is it gives a place for people to do the work after that medicine wears off. And being in community reminds us that we're not alone. And it really provides a sense of safety, connection, and helps that healing take root. So it's a powerful, powerful experience for sure.
Laura,
okay.
Sorry, Sarah. Okay. Laura, I'm curious how your experience with integration with individuals after KAP sessions versus group, kind of how that process differs for you or what your experience has been with that.
Yeah, I feel like when I do individual therapy afterwards, I feel like the person is a little more resourced. So I do feel like they actually come in and their nervous system does seem calmer for the most part. I think generally speaking, people just, ketamine does seem to be kind of a regulator, not for all people, but for the people I've worked with. And so we are able to sometimes do maybe like an EMDR, like target that and do some EMDR work shortly after. That maybe has been harder, but we were able to, again, the neuroplasticity kind of taking advantage of that. So maybe some of that deeper therapy work, if you want to call it that, where I think in the group setting, right, we're not doing EMDR there, but we are talking about like Sarah, just like you said, those identifying the insights, but then really talking about how do I put this into practice? Like, and kind of exploring and not necessarily holding each other accountable, but giving even ideas on how to do that. So I think that that's been really helpful, you know, to come back the next week and to hear, oh, you know, different people in the group going, you know, oh man, I started this like new morning routine, like where I'm, you know, spending some time and just maybe doing a spiritual practice that I've never done in my life, or, you know, like in my journey, it sort of came to me that I needed to, you know, do something more calming in the morning. And so then they start doing that. And so I think that, yeah, the group is more kind of identifying maybe that, like Sarah said, these are those insights. How do I turn those into action? And then sort of that added accountability a bit. But also I think holding each other in the group too, of like, if there's an insight of like, oh my gosh, like I'm not responsible for this horrible thing that happened, you know, and like having this kind of emotional breakthrough, the group members being able to go like, yeah, that's right, you weren't, you were just a kid, or, you know, whatever. So I think there can be some of that emotional work that happens in the group. It just kind of depends, but I definitely think in individual, we can go even deeper with some of that.
Sarah, how do you feel like ketamine fits into your work within functional medicine? Is there, not that there's an algorithm, but for the typical clients that you're seeing, do you find that you are kind of working through multiple different SSRIs or you know, antidepressant medications, or that they're more open to considering something like ketamine as more of a first line option in comparison to some of the other medications that we use?
Yeah, I rarely get that person that is like, yeah, psychedelics right out the gate. usually the person that is wanting that is not wanting necessarily a healing experience, right? So I a mix of people that are like open to the idea and curious, or maybe, you know, earlier in life had psychedelic experiences, and it's not a hard bridge. It's a pretty easy bridge to get from like, okay, I, you know, used it at a concert. I can tell that it like lifted me, and I felt my body and my mood was better afterward. And now I'm curious about what this really looks like within a therapeutic setting. And then I also have people that would have never considered it. And people that are maybe a little bit older or more, have done more of a traditional path around their mental health, and they've not gotten the results that they want and need in order to feel like they're living their best life, and they're just really at a place that they're willing to do almost anything to feel better. And so then that becomes, it would have been something that they would have shunned or had some sort of stigma or shame about exploring in the past, but they become more open to it, especially now that we have good, reputable options in the community. I think that is a big game changer for using psychedelics. Absolutely. Thanks for that question. I'm curious, you know, we've got probably about 15 more minutes left, and I know that Laura and Delaney and I could just shoot them back and forth. But if you guys have any questions that are rising up, please don't hesitate to pop them in the chat. We'd be glad to answer your questions. And so I am curious about you guys. I do have some clients that have some fear, or there's a stigma when they're considering something like ketamine or a different type of psychedelic therapy. And I'm wondering how you guys approach that fear or the stigma as you're helping a client through that process.
I think I can certainly like understand where they're coming from, right? I very much like Laura this is not a path I anticipated for myself professionally. And honestly, it was probably like the trust that I had in Laura as a human and as a clinician that I took the leap of faith. So I think that just kind of leveling with them that, you know, I understand that this feels like borderline, you know, recreational, and but able to be very reassuring with my own experiences and the clinical experiences that I have had, as well as, you know, the data that supports that this is a safe treatment option that's also effective. So I think that I kind of come at it from a couple different angles to hopefully kind of get them to buy into this as a potential option.
Yeah, I agree, Delaney. I think because I think it's more popular on the coast, and so, you know, kind of as most things do, they work their way towards the Midwest, and since that's where we are at the moment, I think there is still a lot of uncertainty, lack of education. I think a lot of people I even talk to, they're like, ketamine's legal. It's like, it is legal, actually. Used in the right ways, with the right prescription, with the right assessment, right? So I think, so really just trying to provide education and really hear what are the fears. Are the fears like they don't know what the medicine is? Are the fears, you know, something I often tell people, and again, not that I want to sell something to them that's not appropriate, but just more if, you know, we're talking and it feels like it could be, if, you know, if they're fearful about the medicine, you know, it seems like most people have no problem taking an Adderall or, you know, some kind of stimulant or Vyvanse or something like that, you know, if a doctor prescribes it. And that is actually a higher level of medication that's, you know, FDA has deemed more unsafe, or I don't know the right word, more regulated, so to speak, than ketamine, because it is generally a pretty safe medicine. And I know, there's been a lot of bad press with it because of the Matthew Perry death. And I think what a lot of people don't know is he really wasn't taking it safely. He ended up, it was from drowning that he died, not from the ketamine itself. And so I think having, being in a safe environment, being with proper care, being under medical supervision during it, I think all of those things are very important. And I think we take them very seriously, especially our assessment process. So yeah, I mean, I think addressing fears that are valid, and some people, those fears should be listened to, and that just tells us that they're not ready, or maybe they'll never be ready. So Sarah, I don't know if you have any other last thoughts on that too.
I'm curious, and Denise just popped a question in around any negative side effects that you see with ketamine therapy.
Yeah, so most commonly, sometimes we will pre-treat if you have a history of motion sickness. We will pre-treat for that to prevent that from being a side effect. Nausea can be relatively common. We do recommend 4 hours fasting 4 hours prior to the actual treatment to prevent any sort of nausea or vomiting. Headache, of course, can be a side effect to just about anything. But sometimes just kind of feeling a little bit like maybe just like a little drowsy or a little bit in a fog after the treatment session. But ketamine is a very fast acting medication, and it also is, out of the system relatively quickly too. So that piece is helpful from side effect profile.
I would also say dreams. We get hear people having a lot of maybe more vivid dreams, and not necessarily like nightmares, could be, but mostly just like kind of more intense dreams than maybe they've had. One of the psychiatrists that I've worked very closely with and got trained by, he works a lot with ketamine, and his kind of theory is that ketamine works a lot to help with sleep and repair sleep and make the brain better to sleep. And obviously we know sleep is so important in mental health. And so there seems to be something about sleep and maybe the REM cycles and dreams that also seem to be helpful in some of that too. But the dreaming, if someone's not used to dreaming, it can be a little like, whoa, I was dreaming about dinosaurs last night and that was crazy. But sometimes we can go, interesting, like, what's the metaphor of dinosaurs? Like, can you bring anything about, from that to actually kind of bring forth and maybe be part of the healing in the intention setting?
Yeah, I bet those dreams could be all kinds of rich information that your psyche is giving you, and, part of that creating those new neural pathways for sure. So Jill has a question, actually has a couple of questions. The first one is about using ketamine to help with addiction, specifically marijuana addiction, or I'm also curious about what about like alcoholism or other types of addiction?
Do you have any initial thoughts, Delaney? I toss it to you first if you have any.
I don't. I can't say that I've specifically looked at research associated with that. So no. Are you familiar with any, Laura or Sarah?
I know it can be, it has been used in some circumstances, and I think it can be helpful. I think I'm always just wanting to be thoughtful of where in that process of addiction are they and the risk benefit of it. I know one thing Delaney and I also do after every medicine session, we do a follow-up assessment for each person. And so one of the questions, are you having, increased cravings for ketamine? So, and so far everyone said no, but I do think that there is, I'm just not super familiar with it. And I think not being, an addiction specialist in that particular way, I think that's one area that Delaney and I have talked about just for ourselves, is that we would want to be very thoughtful if we used it with someone with an active substance use disorder. And because neither of us are specialists in that area, we may even refer them to maybe others who have more experience with that. But I do know in some of the trainings we've been to, they have talked about it being helpful for some people. I just think it's an area that I want to get more training and learn more, so I would feel more confident assessing if someone would be appropriate or not.
So I know, like, when you and I talked, Laura, you were kind of thinking about doing these sessions and doing them with like kind of a certain, I want to say theme, but
cohort.
Yeah, certain cohorts. And so this might be an idea for that.
Mm-hmm.
But Jill's question, well, another question that Jill had was, does this help with clients, or is it used to help clients become more regulated and then be able to do deeper repair work within their relationship?
I definitely think so. I mean, I think about some of the folks who've come through our program with Delaney and I think about just some of the stories of being able to come back, you know, the next week and just be like, yeah, like I just don't feel so on edge. I've been able to like move through my life more flexibly. And I think about, right, if someone is just noticing even that subtle flexibility, how like that feels like it would be such a great place to then be able to go do maybe deeper couples work and not be so kind of defensive or reactive, but kind of be able to move, you know, and do that. So again, I don't know that we've used it in that way, but I absolutely think it could be used. I do know, I don't know if anyone here has heard about internal family systems, IFS. It's a type of therapy. And so they're blending a lot of times IFS work with psychedelic work. And so when I was at Psychedelic Science, the founder of IFS, Dick Schwartz, showed a little video clip he had done. And so he had, he was doing a couples therapy session with a woman who had taken, her husband hadn't. And it was a very low dose, way even lower dose than what Delaney and I, or what Delaney prescribes often for what we do. But it was such a low dose that the person just felt relaxed and was actually being able to kind of do some internal parts work as it related to their partner right then. And so we watched a video on that. So I know they are, like I said, it's a little, I don't want to say it's Wild Wild West because I think there are protocols and we want to do this in a safe way, but I think it's creative, right? I think right now there's a lot of creativity in this area of going, how can we use it? And would it work here? And what about here? And so I think couples work is a potential one. Not legal yet, especially here in Indiana, but the MDMA seems like it's also going to be a potential for couples work as well. It seems like there's some really good research that's in some of the clinical research that they're doing with that also might support that. But again, not legal yet. Oh, I think you're muted, Sarah.
So Jill also makes the comment that she'd love to refer certain couples for that, and use that sometimes people are just too triggered in their relationship to make progress in their relationship. And what I'm going to say is, if you've signed up, what I'm going to do is send a follow-up email, and it will have Dr. Oyer's information, it'll have Delaney's information, it'll have my information, and it'll have access to the Holistic Health Hub, where we'll do a replay of this call on there, and then any resources that the expert panel has found to be helpful, we'll add that to the Holistic Health Hub as well. So we will give you the resources to be able to reach out and refer. That'll come in your inbox tomorrow. Any final word?
I'm thankful, Sarah, to be able to have this conversation, and just thankful to the people who joined and are interested. I think curiosity is such a great thing, and I don't believe this is for everyone. And I also just hope that we can keep having great dialogues. And again, we get more research and more information just to keep refining this, so it can be a really helpful tool for people to keep healing. So yeah, my final word is just thanks for having us, letting us have this chat.
Yeah, likewise, just reiterating what Laura said, and also to talk about like Jill, I think that the experience of doing KAP in a group setting is like in and of itself is bonding. And there's something about just like being in space with people that are there to heal and are, you know, willing to put in the work to do that, that just kind of like helps everybody step into that space and just kind of drop their guard. So I do think that that would be a really neat experience for those that are at odds with each other.
Yeah, absolutely. Well, thank you, Dr. Oyer and Delaney, so much for coming in and speaking and participating and giving us so much great information about, I think it's probably Fort Wayne's best kept secret at this point, but hopefully we're going to get the word out and get the right people into your program and start seeing some really amazing healing happening in our community. So thank you guys for coming, and look for the email.
Great. Thanks, Sarah.
Thank y'all. Bye.
Thank you.
Bye.
Bye.